Well, perfect. Thanks for having me. Also, wonderful opportunity, I guess, to speak into exercise and mental well-being and mental health. Quite an interesting topic. I think when one tends to look at just the value of exercise with regards to mental health, there are multiple aspects to actually think of. The first are maybe looking from a more scientific basis as to what exercise actually does, maybe on an anatomical level to the brain itself. And there are studies that show that potentially the area in your brain, the hippocampus, and also if you follow the hypothalamic pituitary axis, if you follow that region of the brain, you tend to find improved vascularization, so better blood supply, blood flow to the area. Interestingly, in the time I was preparing for this talk, I found that they spoke about a study where 10 runners, or 20 runners if you want to call it that, 10 were given the idea that they should go into training, and then 10 were put into non-training. And after a certain period of time, they evaluated the size of their hippocampus. And what they found was that the guys that actually had continued training, they were slightly larger, which than the guys that had stopped training. Now, what that translates into, I think you really need to contextualize it, because that region of the brain is also important with regards to your emotions and your long-term memory. And once you start understanding, better vascularization of areas like that, you start sort of getting concepts of understanding that, well, better memory, improved memory, perhaps better improved emotional well-being from that perspective. I think beyond that, the other things that are there in literature tend to point to how exercise is of benefit to those that may have mental disease. It speaks into how exercise may be beneficial specifically in depression. And I guess there are multifactorial things to consider in that. It's not just a single dose of exercise. So if you think of taking a dose of medication, it tends to become repetitive exercise. And the question is, what is the minimum effective dose? Well, you're looking at maybe upward of 20 minutes, 20 to 30 minutes on most days of the week, which is what some recommendations may be. But if you're looking for something more specific, like an 8-hourly dose or something, then you can look at probably 3 days a week. And with that, the kind of, what one tends to hear around bandied about, it tends to be things like the release of endorphins. It's not just the endorphins alone that I guess that are there that can elevate mood, but you tend to find that hormones that are responsible for you having the positive feelings, things like dopamine, tend to be elevated, and dopamine and serotonin tend to be elevated in post-exercise. So those things, if you look at them, they become a physiologic way without needing some sort of allopathic medicine to get yourself into a place of actually being in a better state mentally. It was interesting because I guess when you listen to some of the TED Talks, a researcher spoke about how even her students, what they noticed was the students' concentration levels seemed to improve. And it wasn't just the concentration levels, it was also in terms of certain tasks, which were quite specific. I wonder if she spoke about geometric forming tasks. And it sounded like there was great improvement in the capacity to do those within the class once she put in this exercise regime that she had actually manufactured as a scientific experiment for her class. Now, what's interesting about her persona and her research and the way she conducted it was how she applied the exercise method. When you take it and you listen to her methodology, her exercise is not simply exercise, it also includes affirmations, the way that one speaks out. Now, I never advocate one, in my time I guess on this earth, I'm learning bit by bit that the textbooks aren't the whole truth. And the things that you tend to read, unfortunately, once they're bandied about and a group of people sit in a room somewhere in Brussels or whatever it is, they will evaluate that and decide as to, is this the truth or not? And that truth then is then bandied, called a fact thereafter. It's not necessarily Brussels, it could be anywhere, who knows. But the point I think that I was trying to make about it is that over time I've started to learn that we tend to sometimes think that there's a cause and effect way to living. And as we get older, you tend to start understanding that, you know, even as you change, of course, your way of thinking about how the body operates, the body takes in things, the body asserts itself, the body expresses itself, those things change. Now, it's the same, I guess, when it comes to exercise and call it exercise and mental well-being. The dose probably changes as you get older. The requirement of the type of activity you can do to achieve the same sort of state of mental well-being changes. Not just that, but also perhaps potentially even the type of exercise may end up having to change. But I do think that what I take from having listened to this research is that part of it is the affirmation side, which I think is one thing that's always consistent with human beings. Receiving positive messages has always probably been associated with some sort of positive outcome in most studies that are performed. And I guess the combination of those two factors will always result in something that's positive with regards to your mental well-being. I'm an advocate for exercise as therapy for multiple conditions. And following, just looking this up and then looking into the subject, I am now an advocate for exercise as a way of dealing with mental illness.